Okay, good noon, all the delegates, dignitaries, and my co-instructors. It is a unique conference, and let us enjoy it the way it is. If it would have been a physical conference, you would all be inside a lunch room and eating our lunch. Unfortunately, we are eating our lunch on our own table or in our own hospital, but well, enjoy whatever is. And practicing what you have learned is necessary, and earning a livelihood is a part of it. But at the end of the day, you have to be satisfied and enjoy what you are doing. As you all know, the title of this instruction course is Group Practice, a tough call. Maintaining the group is even tougher, and gracefully exiting is always a nightmare. I invite my co-instructors, Dr. Usha Jowhari from Mumbai, Dr. Reshma Javeri from Mumbai, and Dr. Senthil from Chennai. The course, when submitted, had allotted a big chunk of its time to discuss individual cases and then carry them over outside of the hall if needed to intense one-to-one discussions and deliberations over breakfast, lunch, or dinner, or whatever time that we can find. There cannot be a one-size-fits-all formula, nor can we have a textbook picture. But what you can get is some ideas after listening to the speakers. You might be at various stages of your career and contemplate to form or join a group. Let me clarify, we are sticking to a complete group practice in this course. We are trying to devote more time to one concept wherein the entire practice is in a group. There are other possibilities of how you can join and associate, but we will try and not touch them or not do a lot of discussion about other varieties. So we are trying to going to stick to a group practice model where everything is in the group. Well, the biggest dilemma, congratulations, all ophthalmology graduates. But are you ready for your first job? Well, like Dr. Rohit said, he did a job in Gomach, I think, Netralaya, and then after 6 years now he has taken a plunge. So somehow this is a question which comes to everybody's mind. What next? Or what first? In this course, we are trying to address the following following five subjects. Why to step into a group practice? How to convert from a solo practice to a group practice? How to negotiate your entry into a group, or you can even form a group. You've already been in a group. Well, how are you going to survive in a group practice and make sure that you, at the end of the day, you're happy about what you're doing? And of course, very important is for any venture is how will you exit a group practice gracefully, or we are also going to cover if all the members of the group want to exit, how are they going to be able to sell their practice, right? Okay. I had a question for all the audience, but I believe we do not have many, so I'm going to skip this question. Why group practice? It's a long and tiring journey to become a specialist, and even a very, very tiring if you are a super specialist. You have spent a lot of years, and then you actually, I would say, dug yourself into a hole because, like, say, somebody would be just an ocular pathologist, or somebody would be only doing an oculoplasty. But well, that does not always mean that you're going to survive on that. There are n number of cases where a glaucoma consultant also does a lot of other specialty, because to survive they need to do other specialties also. I can give my example. When I finished my master's, I joined my fellowship in cataract and refractive cataract. At that time there was no refractive surgery in 1992, and then I went on to do a fellowship in cornea. But there wasn't enough work in cornea to make me survive. So I had to actually do more things. At that time, there was only keratoplasty, and that wasn't also not enough. So I then again became a cataract surgeon. Well, but I had another option, and that is I started a group practice in 1992, 15 December to be precise. Right? Why? Because I need to justify my specialty also. If I keep on doing cornea or keratoplasties, I would have not been able to work for the whole day and would have been killing my time doing something which I should have not been doing. Well, what did I do? I spent my time in setting up a neutral surgical center at that moment of time. So the main advantage was that you have the access to the best, right? Once you are in a group, you have an access to the best. How? For example, when we started our practice, FACO was not doing that great. One of the reasons was that people used to condemn FACO for the only reason that they were not doing it. Our group started operating phacoemulsification surgeries for other doctors. What happened? Very soon, Ahmedabad became a hotbed for phacoemulsification, and probably all companies were selling more phaco machines in Ahmedabad than even Mumbai or Delhi at that moment of time. So this is how I justify access to the best. Okay, just like we were discussing with Dr. Rohit, not to lose or send a patient. So whenever you are in a group and if your group is complete, what happens is that you don't need to lose a patient or send a patient. Well, when I say lose a patient, I mean it is referring a patient. It so happens that when you refer a patient, there is a fair chance that the patient might then continue his or her practice with the doctor to whom you have already referred the patient, right? So whenever you are in a group and whenever you have access to almost everything in the group, well, you do refer a patient, but then it is not outside your group. You do send a patient, but then it is not outside your hospital. It is in the next room, and the next room also belongs to you. That is the biggest advantage of a group practice. Of course, it gives you a better quality of life because I'll tell you what, in 92 when I started my clinic, if the door opens, I was so anxious I would look at the door whether it's a friend, a relative, or a paying patient. And at the end of the day, if you have not seen enough patients, you go home and it does not translate well in your home also. So this is one very good aspect that you have a better quality of life. This was one example. There are many more which will make your quality of life better. Of course, there are all the other advantages of a group practice. Well, you share investment, you share maintenance because you might be a good clinician, but you might not be a good administrator. You might not be able to, you just want to go to the clinic, see some patients, perform some surgeries, and come back home. Well, but does that mean in a private practice that you can only do that? No. You go to the clinic and then you might find out that the electricity is not working. You might see that the staff has not come. You might see that some instrument has conked off. Well, and you actually end up tearing your hair if you have, and uh, ultimately the frustration translates to your treatment. So this is how you share your maintenance. Very important now is the legal responsibilities. In a group, you do not only share your legal responsibilities, but you kind of make yourself cocoon in a way that, okay, well, I have always somebody to fall back. I have always somebody with whom I can discuss, and you can discuss very frankly. And that is why this is a very, very important aspect of a group practice. Like I mentioned in the beginning, there are different types of group practice. There can be, depending on your demography and your requirement, a variety of group practices. One very familiar and uh, uh, another type of group is a limited group, or a limited group where It's only either a diagnostic or a surgical, or it's a combined practice. This is the type of practice where you come together to run or share a limited scope of facilities. That is, a LASIK center is a very classical example. There are so many uh, neutral LASIK centers. Similarly, there are many cities where they have a diagnostic center. If you want certain investigations like a very high-end optical biometer, you want a OCT, you want a perimeter, you want a ultrasound, a UBM, you want a specular microscope, and it is not possible to justify the high investment because you might be doing only a few cases. Well, you can have a group having a diagnostic center. Here, the difference is your OPDs are not a part of the group, or it might so happen we have actually been able to conceive a couple of such groups where it's not only the OPD but the cataract center is also their own, because cataract is what almost everybody does. So these are the groups where the OPD and cataract is their own. But for all other requirements, they go to their own center. So this is a limited group, and this is also a very successful model. In fact, this could be the beginning of or the first step towards a total group. In Ahmedabad also, to begin with, we started as a neutral surgical center, but just in a couple of years' time, we went into a total group because the reason was that all the doctors who started visiting our diagnostic and surgical center, we started knowing their volumes. So one fine day, a huge trust had already been um, created. We actually even knew our type of and the scope of practice, and we knew our weaknesses and our strength. Very soon, we developed ourselves into a group, into a total group. And when I say total group, every aspect of a private practice is shared. So there is no me, it is only us. In this type of a group practice, everything is us. So every penny goes to the group, and hence there is no conflict of interest. This is, to me, the best possible way of practicing in the present scenario. Yes, you can have a limited group, but again, understand, if you have anything in which you are a solo practitioner, the condition is known as shutters down, meter down. I hope you all understand the concept. The moment you leave your practice, even for a week, all the other expenses are growing, but your income is negligible. You might be able to find somebody who will run your center, but well, you are never very comfortable with that. You are always anxious. You are always worried. What will the stopgap or the locum doctor be doing in your clinic? True? Do you all agree to that? You can write in the chat box if you can agree to that. A group practice. What are the certain questions that come to you when you are joining? What will I get? What is the assurance or a guarantee that I will do better? Very important is what will other get? Sorry, what will others get? Females. This is one very important topic that I'm going to touch upon after others have spoken, and a mixed bag of participants. Right? So these are all the points that come to a mind whenever you are trying to join a group practice. And so now I will ask my other co-instructors to start their presentation. Dr. Senthil, are you ready? Dr. Senthil, can you unmute?
Hello. Sir, I will let other doctors do. I will do the last presentation.
So the last, well, okay, then we might have to.
Yeah, maybe Dr. Usha.
We will move to you. Are you ready with your presentation, Dr. Usha? I am still going to share my screen. Please let my screen be on. I think okay, my screen is on. Sorry. I will introduce Dr. Usha Johri. So our next presenter is Dr. Usha Johri, and she is from Mumbai. She is the director of Johri Eye Center. She is the past president of BOA. In fact, last year only, she was the president of Bombay Ophthalmic Association. She is currently the vice president of MDMA. She is the chief director of GS, MICS, and the TP, that is the MICS group. She is the president of the women's wing of ISM SICS, which is the international group of SICS. She is an executive committee member of the IACP, which is an Indian Academy of Cerebral Palsy. So it seems that Dr. Johri can put on a lot of hats, and she also is very active in community ophthalmology and cerebral palsy. And in fact, Dr. Johri did a lot of work during her presidency and took Bombay Ophthalmic Association to great heights through her very proactive programs. Dr. Usha, please share your screen, and the floor is all yours.
Yeah. Am I audible?
Yes.
Yeah. Can you see my screen?
Yes.
Okay. Thank you very much, Dr. Tejas, for that wonderful presentation and the kind words that you spoke about me. And I'm very happy, a very good afternoon to all of you. And I'm very happy to be on this platform. And I thank Dr. Tejas, of course, and my co-instructors, Dr. Jayashri, Dr. Reshma Javeri, and Dr. Senthil for having given me this opportunity. So let me start, saying that it's a wonderful talk that Dr. Tejas has covered up most of the aspects. But let me tell you that we need to think big. We need to take a very big step before we start moving from a solo to a group practice. The talk that has been given to me is how to form.
Sorry to interrupt you. Can you make it full screen?
Yeah. Okay.
Yes.
Yeah. So the talk that has been given to me is how to form a group practice. And I'm sure there would be a lot of overlapping. And Dr. Tejas right at the beginning has covered most of it. So we are here just to, summarize and give our thoughts. And let me tell you very seriously that the things you should know before moving from a solo to a group practice is you need to think big. So that would be my suggestion. And it's very important that, for all of us to know how we negotiate our entry. And negotiation is very easy only if you know how to exit from the group practice, which I think I'm sure at the end of the talk, it will be covered by the expert panelists. So in my opinion, if you are entering, you must know the way how you are exiting also. And the most important aspect is that what common people like we are achieving, it's not very, it's extremely difficult. But the secret is what a team achieves is extremely important, and they achieve a lot of things which common people like us don't achieve. So in my opinion, this is an excellent platform to form a group practice. Unfortunately, I could not do it. But after hearing this topic, I think I would definitely love to start a group practice. Now, let me talk about the vision. The doctors or the group who are forming the group practice must have a very, very clear vision, a holistic approach, and they should be very comfortable with each other. And in my opinion, They should be school friends, or they should be college friends, or they should be batchmates, so that each one of them know the negative and the positive aspect of each one another. So in my opinion, vision definitely holds the forefront. Now, how do we begin a project? So when you start, when you start beginning this project, it's extremely important that you have multiple meetings, multiple discussions before you jump into a group practice. And there should be a one person who would be coordinating things like staffing, directing, controlling, planning, and of course, organizing. Now, the processes that are involved for setting up a clinic and an operation theater, the most important is a title. A title has to be a neutral, so that everybody are contributing equally and everybody are getting their share. There should be a very excellent planning, like premises, area, interiors, equipments, diagnostics, surgicals, disposable, staff recruitment, maintenance, and of course the recurring cost. Now, how do I find the right people to join a group? And in my opinion, group is nothing like an extended family. They should align together and they should adapt together, like how we get adapted when we get married, isn't it? Come what may, we live with our family, we give life our family, we are looking into the family's ups and downs. So similarly, when we are in a group, if we have this kind of a mindset that we have to align ourselves and we have to adapt ourselves, then I think most of the job is done. Now, coming to the era of super specialty, if I'm a cataract surgeon, now I have got into, cerebral palsy and eye problems. And, very soon we are coming out with a pro forma, which will be the first time in the country where eye problems have been neglected. Now, from cataract, I'm moving on to cornea. I'm moving on to, cerebral palsy patients. I am doing, something levator, oculoplasty like LPS resection and things like that. So is it possible that I can be an expert in everything in the present era where there are so many super specialties? So why don't we think that, that we can distribute the work among the surgeons so that I'm not burned out and I'm not in touch with, with the latest technology of all the super specialties. So what more does a surgeon need? In my opinion, I think in this era of super specialty, we should all join together and distribute work so that we enjoy what we are doing today. Now, I have classified the team heads basically into these four categories: academics, economics, marketing, and of course the mindset. Now, let us all agree on this point, okay, that none of us are perfect. But don't you all agree with me that the team is perfect most of the time? Because there are so many heads involved, so many specialists involved. And I think ophthalmologists are all highly intellectual people. So when we form a team, we are definitely more perfect compared to an individual person. Now, coming to the academics. Now, let me tell you, the person who is into a solo practice, are they exposed to the skills that another surgeon is doing? Are they brushing up their theory? Are they developing the personality? Are they learning how to do research, innovations, how to interact with the surgeons, how to interact with your colleagues, how to interact with your patients? And this is extremely important in today's scenario because it's a competitive world. So as a surgeon, I always had a surgery phobia. When I did my first cataract, I remember how I was trembling with my superior seeing. And as a surgeon, in contrast to that, we always have a surgeon craze. Every surgeon has a craze to do the surgery because we are trained that way and we are made for that. So this is an ongoing process of academic excellence, which can happen only when you're in a group or when you're in a big institute. But since the topic is only a group practice, I would definitely say that when you're in a group practice, you are up to the mark. Your academics are superb, and you are well versed with the advanced technology. Now, coming to the economics, of course, we all want money, isn't it? And the income, expenditure, the self growth, perks, distribution of work and money, all this has to be very, very transparent. And at the end of it, having worked so hard during your undergraduate, postgraduate days, setting up a practice, we definitely need financial stability. It could be an active or a passive stability. Marketing within limits is nothing wrong in it. So the best persons to market your practice are your happy patients. Of course, the electronic medias are there, WhatsApp, telegrams, emails, TV interviews, and updating, yours, in a group with multiple specialities that you have, and giving them educational material. And of course, your receptionist and the staff, they matter a lot, especially in a group practice, because there should be no division, amongst them. They should consider all the staff should consider all the consultants who are in the team as one. Now, the mindset. Definitely, you'll agree with me that team is bigger than an individual. Whenever there is a problem, we have to definitely keep the team before us, and we have to put all our personal gains and egos on the side. Transparency should always be maintained. If one of our colleague has any problem, we should always support them, involve all the team members in all the decisions that we are going to take, and this can happen only when you care and love. But at the same time, you must also have fun with your team members, and that only creates a bondage. So feeling of belonging in abundance, it plays a very important role when you're forming a team. Now, medical legal issues like, no, we have to have a lawyer, which an individual person cannot afford. So the agreements, appointment letters of the hospital staff, doctors, everything has to be in place. Indemnity of all the consultants. If we are, starting multi-center practice, then you have to have an MOU with the corporate hospitals or the charitable centers. And of course, the licenses, which in present scenario is a very difficult task. So let's take all this on our stride and stand by each other whenever there is a mishap. Why should you join a group practice? As Dr. Tejas rightly mentioned, do you want the headaches of, every day, administration, light is not there, fan is not working, machine is conked off, things like that? No. If I'm a skillful surgeon, and if I want to improve my efficiency, lifestyle, and income, I would definitely like to be in a group practice, and I would, opt for it. Now, let's accept the facts that COVID has got us all down. Less patients, less surgery, less socializing, and you'll all agree with me that this is the right time and the best time to form a group practice, because then there's no financial burden to each one of us. And then, of course, we are also, doing our surgeries. So as intellectual community, we know where is our bread and where is our butter. So let's balance it out and move further. Now, the models of making an entry in group practice, I have basically classified into two, where a doctor, especially a beginner, has no money to invest and he can only get patients. The type 2, where he can invest a small amount and also get the patients. And the third model, where a person can invest in advanced equipments, where an average surgeon or a beginner will not have money to put in an advanced technology, and of course an experienced surgeon, and of course an invest in expertise. So in all these 5 models, I think it's the time which is very important, that one should give time to form this group and take it forward and run it all their life. So the best model, in my opinion, was that if there are some good practitioners who are well known and they invest equally in technology, there's no financial burden to any one of them. And they're all well-established doctors, reputed doctors, like-minded. So they don't have the headache of managing day-to-day affairs, and they would dare to invest because they are all established doctors. They would be, having advanced technology, which a common surgeon or an average surgeon will not be able to invest. So there is no surgical stress to each one of them. And I think, in my opinion, this should be the best model. So let me say that let's carve out a niche on the world map. Arguments, disputes, thought processes, they do happen, but let's not carry them. We are all having a different goals, different paths, and different ways of working. But the end point is, can we give the best to our patients? And yes, we can. It is possible only when we have a group practice. So my take-home message to all is, group practice is for strong-hearted. Know when to get in and when to get out. Keep emotions at bay and make sure that everyone is involved. Keep your eyes and ears open. Only medical work does not make you a great partner. Remember that, because we are so focused in our own education and in our own practice that we always feel that we are the best, but it's not the case. And group practice in today's scenario is everyone's cup of tea. Do what suits, but at the end of it, remember life should be fulfilling and life should be full of fun with all your expertise. And thank you for your attention. And stay home, stay safe. And uh, I have finished with my talk. Thank you.
Thank you, Dr. Johri. That was a very crisp and precise presentation. If in one sentence, if you have to give some message of how will you join a group, what would come to your mind? Finding a group or joining a group?
Finding the right people to join the group.
Correct, correct. That's going to be a big headache because,
Yes.
like you also mentioned, it is not only about the marriage, but well, here there are a lot of many other aspects. But well, if you are bound in that sacred bound, you are going to be very successful. Thank you, Dr. Chori. And
The other thing I would like to tell you is, in olden days, our elderly people, used to have, multiple children, one looking after the other one looking after the other one, and that way. So if a father is an ophthalmologist and if he has a dozen of, children who can become an ophthalmologist, that would be the best situation.
that's too futuristic, or I
Yes.
would say it's going back in the time too much.
Yes.
Okay, great.
Yeah.
Thank you. And I will invite you again for our panel discussion.
Yes. Yes.
So our next speaker is going to be Dr. Reshma Javeri. Is my slide visible?
No.
No, fine. Okay, I think you have to stop sharing, Dr. Javeri.
Yeah. Yes. Yeah.
Wow.
Yeah.
And she's our next speaker, right? I
Yes.
have the pleasure of inviting Dr. Reshma Javeri from Mumbai. She's, of course, an anterior segment surgeon, but she's a part of a multi-specialty hospital called Criticare Hospital in Juhu area, the very famous area. She has been in practice since 2006, has been very active in a lot of forums. But well, this is something which I would like to highlight, and that is last year she participated in Mrs. India World Pageant, where she was the finalist, and she also got the title of Mrs. Beyond Giving. Well, Dr. Reshma, please start sharing your screen, and let's hear from you. Thank you.
Thank you so much for this very kind introduction, Dr. Tejas. And can you hear me?
Yes, yes, go ahead. Loud and clear. We're just waiting for your screen to appear,
So,
and there it is. Okay.
okay. Is it there the screen I've already put up as a screen sharing? Can you see the screen?
Yes, please go ahead.
All right. So at the onset, I'd really like to thank AIOC, Dr. Partha Vishwas, and the entire team. Thank you, Dr. Tejas, for this very interactive and extremely for today's date, what's important, the group practice, and I would love to talk more about it. At the beginning, Dr. Tejas has already spoken about why a group practice. It has been explained so very well, and Dr. Usha has also explained beautifully how to go about being in a group practice. And my talk is now more on how now we've already entered a group practice, right? How are we going to survive this? How will we survive a group practice is what we will discuss here. Okay, so let me start by saying that let us remember three simple steps. It may sound simple, but when we are in that practice, there will lot of things that will come our way, and how we handle those situations when we are in the midst of dilemmas, in the midst of a lot of questions that may come to our mind when we are in the group practice, how to deal with those, and how to believe in our own selves that no, this is what I wanted, and that is why I'm doing it. So this is the first step, is to understand our own selves. What do we need to understand? We need to understand that, okay, I have been practicing solo for all these years. Am I now ready to enter a group? If I'm ready, why am I ready? What is it that I'm expecting out of a group practice? Um, will I be able to survive through all those questions that might come up later? So, the first step is understanding our own selves. That, is group practice right for me? Is it what I really want? This is what Dr. Tejas has already explained, that what are the pros and cons of a group and a solo. A quick recap of that is that if you are in a solo practice, what are my advantages? That I could do my own thing. I could I have a free hand to design, develop, and grow my practice. I can control the relationship with my patients and can offer more personal care on a one-to-one basis, and I can also have my own dedicated staff that is only to my own self. But of course, all of this has its own cons, and that starting as a group practice has a much bigger advantage, because as a group practice, your overheads are less. You do not have the total responsibility of your own private setup, as Dr. Usha has already mentioned so very well. Your overhead, staffing, and your business operations, all of that, it is divided responsibility, and it just doesn't come on you. Lost income caused by illness or vacation, or more work in longer hours with minimal peer support on that we otherwise have in a group practice. So a lot of advantages are definitely there when we go ahead with a group practice. So now in my mind, I have decided that yes, I think I'm ready for it. I'm ready to move out of my own comfort zone of a solo practice. I'm ready to move into a group where uh, I would want to associate with like-minded people, with people who are from my batchmates, or with people who I feel I'm going to be extremely comfortable being day in and day out with them, and being as a part of that group. So once I decide I have entered a group practice, there are many different models, as again which has been explained earlier, but one of the models that we see in Mumbai is what is called as either an association or a partnership. So what is an association? An association is like a multi-speciality hospital, like how I'm in one of the multi-speciality hospitals of Mumbai. It is called Criticare Hospital. It is owned by a particular doctor, and we are a part of that entire team. So that is one kind, which is known as the association practice. And the other is a partnership, which is a group practice, which is a practice where we all are together. And the main differences that are that in associate practice, the associates do not share the income, whereas each partner of a partnership practice shares all incomes as per decision made by all. Also, the responsibility of expenses per physician is usually proportional to the amount of time they work in an office, like, or in a hospital, in a multi-speciality hospital. Whereas if you have a partnership, you have to share all the expenses that are there. You're not professionally or legally liable to each other in a multi speciality hospital, whereas you are legally binded in a partnership agreement. So that was the step one, that, okay, I am ready, the readiness of being in a group practice. And then, if I'm ready, what kind of model am I looking at? What kind of model will I be absolutely comfortable for the rest of my life? Because this is not something that we are planning only temporarily. When we plan it, it has to be that we are thinking of it for good. So the second step to this would be that your mindset and willingness, not only about each and every aspect of the practice. So from if we are moving from a solo practice to a group practice, we know it is going to be a really huge transition for us. And there are some questions we need to ask our own selves to see if we are fit for a group practice. Let us consider some examples. Like, for example, if I want, if in a group, in a private practice, say if I want to take a vacation, if I want to take a leave, I can just shut my shop and move. But as Dr. Tejas said, that of course shutting shutters means you're putting, there is no income that's coming in at all. So that is one disadvantage. But the advantage of a solo practice is that I don't need to ask permission, I don't need to see if others are okay with it. But in a group practice, what would you do that if two people want to take leave at the same time? So we have to have that understanding, we have to have that mindset. If we want to survive in a group practice, we need to understand each other, and 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 understand that it's not only for us, even the others would require the same. Also, if in case there is, for example, there is an account where something has to be done and a vote is with the partner and not the associate, how would we deal with such situations? So a lot of these different kind of situations will come up, and how we deal with it, have a positive mind, have a mindset that yes, we want to survive in this group and we will do anything, and we will go beyond our comfort zone to continue with the group practice. The third step is, how will you survive while making these decisions? So let us again see some situations. For example, if you are in a group practice, and everyone is given a major responsibility, are you ready to handle that responsibility equally well, or even better than what you would do in your solo practice? Okay, then if it's great when everything works well, but what if the boat starts tilting? Is it, are you going to be the one who will take over that command and see that this does not shake and it sails as well as the whole group would expect it to do? Then let's say if there is a situation where patients are getting diverted by one of the partners, how would you deal with such situations? Also, understanding the working capital. What if there's a dearth in the primary capital? Are you willing to put in or chip in more to make this survive? It's all about survival. So it's all about the mindset and how willing we are to go ahead and go through all of these. Other important rules are that one of the main important part that about this entire thing is that it's not about me. It's definitely not about me. It is all about we. In all our talks, in all our website, wherever the group has been put up, it has to be portrayed not by individual names, not by putting up as this is my clinic. It has to be, it is our group practice. So it is not about me. It is definitely about we. More details about the exit policy is going to come up in this talk, but we have to just understand that if one plans to leave the group, he or she cannot practice within the radius of the main center, and that would become a deterrent to leave the group and not fight over petty things. So it's extremely important to understand that uh, everything has to be very clear. The understanding between all partners have to be well discussed in advance. Also, one very important thing is that every week the group should meet to discuss things further, to come up with the problems, to give clarity, to give transparency to the entire group, and the working of the practice. Coming to one of my last slides, as what are we looking at? We are looking at survival when we are like-minded people. So when a lot of like-minded people get along, get together to form the group, the the probability of this group going further is much higher. And if we know each other, if we know the natures already, it is easier to give in, and it is easier to understand that okay, it is fine and it is just a temporary phase and we will pass through that. Also, there has to be a very, very strong understanding between all the partners of the group. Being positive is one of the most important things, that being positive that this group will survive and we will take anything to continue to be in the group. Understanding one's own expectations, as I said earlier in the slides, when we are ready to enter a group, we have to understand what we are looking at, what are our expectations from the group. And if we are not going to be happy with that, with the initial understanding, I do not suggest that it's then it will be wise to enter a group where there is no understanding. Create a very supportive environment and make it extremely fun. So just to conclude, we have to remember that group practice is like a marriage. It's bonded for life. We have to remember that there is no other alternative. With that in mind, that the group survives. That this is the only last thing, and this is what we are looking at. We are not looking at any alternatives to this. We have to keep all the agreements clear and understand that your expectations before jumping in. Thank you so much.
Thank you, Dr. Reshma. That was a celebrity talk. Thank you for the same. Okay, Dr. Senthil, are you ready?
Yeah, I'm ready. So can you see my screen?
First, let me introduce you. So please stop sharing your screen.
Okay. Yeah.
Okay.
So how much more time we have? We have till
We have
2:30, right?
enough time, so don't worry.
Okay. Okay.
So our next speaker is Dr. Senthil. Dr. T. Senthil, he is from Chennai. Well, he is not only an ophthalmologist. I would not call him an ophthalmologist, but he is a healthcare entrepreneur. He is the director of Pranav Eye Care Hospitals in Chennai. But I believe his wife is more proactive in that venture because he is always busy with the Wellcare Health Systems Private Limited. It's a tele-ophthalmology company. He is the founder of the company. And very important is, you might all know that he is the man or the backbone of the ophthalmic practice development, the OPD group that we call. And I believe he has a very, very important role to play in the career of all the youngsters, or even say people who are doing a practice, because he always comes up with some ideas of buying in group, being together, negotiating together. So Dr. Senthil, I invite you to share your ideas, and please, the floor is all yours. I'll stop sharing.
Yeah. Is my screen audible?
Yes.
Is my screen visible? Yeah. Just give me 1 minute. So thank you, Dr. Tejas, for this wonderful introduction and kind words. You have been a great support for me right from the days we started the first ophthalmic practice development conference, because one of the most successful group practices I saw was of Dr. Tejas in Ahmedabad. Though this concept of group practice is being talked about a lot, and whenever in conferences we all rave about a group practice, the benefits of group practice, and how beneficial, how useful it's going to be to the youngsters. But still, how many actual group practices are in existence, and how many group practices are actually surviving is a question mark. So because in India, let's say if there are 6,000 practices, 6,000, 7,000 individual ophthalmology practices out of the 20,000 ophthalmologists in India, but the number of doctors who practice in a group is very minuscule. Maybe I will say it's less than 100 or maybe 200. So the number is very less. So maybe there are reasons why these group practices are not coming up, or is it a mentality issue, or is it a financial issue? There's a lot of things are there. I think the previous speakers covered in detail about the various aspects of the group practice. But the topic given to me was how to convert your practice from a solo to a group practice. So I would like to start with the quote of Mother Teresa. This is a very interesting, close to my heart quote, where she says, "You can do what I cannot do, and I can do what you cannot do. So it's a very simple statement with a lot of meaning, but together we can do great things. So that applies to a lot of ophthalmologists also. Individually, the skills which I have may not be with Dr. Tejas, or whatever Dr. Tejas has may not be with me. So when we both join together, we can do great things. But we have to find out an amicable way to join together, and that's what is a group practice. So, but over the last, I think this COVID pandemic has brought in a lot of good things, basically because I see a lot of practices which are now coming into as a group practice. And just give me 1 minute. Yeah. So actually, I was speaking with two ophthalmologists yesterday and today, and was very happy to know, like there was one ophthalmologist from Kerala. So he has actually started a venture. So he runs 2 eye hospitals, and then he said, now I've actually joined with another 4 doctors. We have invested money to start a center in Cochin. And then there are 2 other doctors who are also partners working in that center. So that's one ideal model of group practice, where the 2 doctors who are working look at it as an employment opportunity and also a business venture. But for this ophthalmologist is already running 2 centers. It's like an investment opportunity for him, and he said that is running well. So, and today morning I was speaking with one ophthalmologist from Coimbatore. So he said, like over the past 20-30 years, he has opened out a center where other doctors come and use it for the surgical facilities. So they come and do the surgeries there. And he said around 10 doctors are coming and using it. So there are multiple these kinds of group practices which are happening already. Maybe even if a husband and wife join together, I should call that also as a group practice. Or if you are in a family where there are 3-4 people who have joined together, that is also a group practice. So multiple formats of group practice already happening, but unrelated people joining together and starting a group, I think that the number is always lesser. And how do we increase the number of practices? And this pandemic situation has actually forced us to consider group practices, because cost of investment and the return on that investment is not that great when you individually invest. So this presentation is going to, whether it's a solo or group, it basically depends on your personality. I think it's the most important thing. Whether are you a group kind of a person or are you a solo? Because many of us are also having this personality where we cannot work together in a group. Say, let's take the example of a tour. So few of us are okay to go as a family tour, only with our family, but we never like to go for tour as a group. And but there are other people, 10 families join together and go as a group. So it personally depends on your personality. I think that is the main thing. But this talk is assuming that you have decided to get into a group practice, and what are all the things which you have to do to get into a group practice. That is going to be the focus of this talk. So as Dr. Reshma said, finding the right partners. I think the people who are going to travel with you in the bus where you want to reach the destination, I think it's very important to find the right partners. Some tip I can give, some because of my experience seeing a lot of these group practices, the right partner should be of equal chemistry. So basically, groups where 2 or 3 classmates are joined together, or 2 or 3 people from the same college are joined together, that is running well. So basically, they don't have too much of differences in terms of age, or so either join people who are from your same college or same background or same classmates. I think that group works well. Second thing is a group of hospitals floated in Andhra, where these are all from alumni of Arvind. So all the doctors are basically from Arvind. And then I also know a corporate chain, which is an alumni of AIMS, where 3-4 doctors join together. So there should be something uniting all of you apart from your own ophthalmology expertise. I think that will help to continue in the long term. Because when your friends or when your classmates or when you're from the same organization, the culture helps you to move forward in the long run. I think it's important to find the right partners. Another type of group which works is junior doctors and one senior doctor, because the senior doctor kinds of mediates and he kinds of has the last word on everything. So there is a senior partner and then 3-4 junior partners, but that also kind of works well. So I think finding this right partner, if you are able to get this right partner, most of your group practice journey is set. And then most of the time, the problem arises because as doctors, we don't want to have a strong legal agreement. So we should create a partnership agreement, preferably created by a lawyer or a chartered accountant. We don't want to spend money. I've seen a lot of doctors want to start a group practice, but they don't want to spend, say, 50,000, 1 lakh to create a strong partnership agreement, because this is the guiding document which is going to run for the long run. So investing in equipments is important, but investing in a partnership agreement is also very important. And this agreement has to be co-created, like you all join together and create this agreement. Spend 2-3 months structuralizing this agreement. This agreement is going to be the like the Bible for your group practice. I think you have to create a very strong partnership agreement. Third issue, basically, difficulty comes when people don't have a strong business plan. You need to have a business plan when you create a group. So why are you coming together as a group, and what is your turnover now, and then what is it going to be for the next 5 years, and how do you achieve it, and what kind of investments are you going to make in to get that turnover? You have to have a business plan, a book which will it's like a statement of purpose, kind of a book which will create how often the group will meet, and every detail you have to jot it down on a business plan. Get a consultant to draft this business plan. It will also clearly define role and responsibility for each partner, and what are the breach transparency issues which will come. All those things will be in that business plan. So having an agreement is the legal document. The business plan is the strategy document which you should create. And other thing is, what is the rule of engagement for each partner? Maybe one of them is an oculoplastic surgeon, one of you is a vitreoretinal, or two of you are going to be working full time. So what is the rule of engagement for each partner, and how much time each of us have to put into that? And how do we meet every month? All those things, you have to set the rule of engagement. And among the partners, you also divide work, such as one of the partner will take care of HR, one of them will take care of the OT, one of you will take care. Though you're not trained to do that, but still at least you can be involved in that and get the experts to do that. But each partner will have a role to play in the managerial part also, apart from the clinical part. So I think it's important to set the rule of engagement for each partner. The other main issue or a thing which we don't do when we form a group is we don't hire a professional team. Basically, as doctors, we think we will manage everything. We don't need managers to control us. There's no need of a manager to control the group, but we need a manager to look things on a business angle. So we definitely need a managerial team who will actually work on the group, and maybe somebody for the marketing, somebody for finance, somebody. It depends. I don't know about how much expenses it is going to take, but at least we should have a professional team. Why groups survive in America is because most of the work is done by the managerial team. The doctors do the clinical work, the managerial work is done by the business managers. So we should have at least 1 or 2 who will be doing that. And a set of doctors who created a LASIK center, they were trying to do administration. When that happens, it is difficult. So, and this group started falling apart because that managerial talent to run the center was not there. So, as doctors, we are very good clinically, but we need to also dedicate good managers and hire a professional team to run the group for us. Other biggest problem we fail to do, or thing which we don't look at initially, is the finance part. So we all put in say 20 lakhs or 30 lakhs to start the group, but we don't look at the working capital. We don't look at what will happen if the business is in a loss. And so many groups, initially people enthusiastically join, say, okay, I'll put 20 lakhs each. But what happens is if there is a shortfall, each of the lakh each, they don't actually give, because they become jittery and they become anxious. They think, oh, is this business falling apart? Then some of the partners leave. They say, oh, I will not put any more money. I will walk out of the group. So, so the working capital, the break-even point for this business, and then the finances have to be organized at the initial stage itself. I think that is important to sustain as a group. Another thing is governance. So how do we actually govern the group? Like, do we meet every month, and who looks at the accounts, and is the accounting transparent? And what about the patient? Is any partner taking advantage of patients, or is he being fed more patients? So there are lots of those governance issues also which happens in a group. So we need to create the rules for these governance, and then who will be the head for the group, or who is going to take care of this group initially. And then second year, how do we, let's say if there are 5 partners, how do we select the person who will be heading the group in the second year? I think that governance rules also have to be set. Most important is trust and transparency. That's how the group will run in the long run. If this is not there, I think there is no point in setting up a group. So how do we create the trust and transparency among the group members? And another thing is basically, as a group, we are all going to work together, but the group which will sustain in the long run is also a group which plays together. So basically, it's not only earning money and working as a group, but are your families, are the members of the family of the group together, and are the children friends, and do you travel together as a group? And I think that kind of a familial bonding also has to develop within the group members. That is also important. And finally, let go. So maybe there are situations where you have to let go. Maybe one of the partner has to give away, or he might have to let go on something. If everybody starts fighting for one thing, the group might break. So we also should decide to let go. That is important if the group has to survive. And as Dr. Reshma was telling, how do we, on the day one of the group, we also should also plan to have a smooth exit. What if one of the group members die, what is his family going to get? What is the valuation he might get of his partnership in that center? Or how do we bring in a new partner? All those things, we have to create the rules of exit. So let's say some of the group member wants to exit after 3 years. So we have a minimum
I
period for
think
exit.
you got it. Can you wrap
All those
up?
things will come in the agreement, I think. Yeah. So I'm almost done. This is my last point. So basically, in a group practice, it's going to be like a sharing economy, as the other doctor said. So you will be sharing resources, sharing the equipments and everything, which is the model which is being followed by all the companies like Uber, Facebook, Alibaba, and Airbnb. And coming together is definitely advantageous. And I think Dr. Tejas spoke about the different models of the group practice existing. And these are the common problems why the groups doesn't sustain. So improper structuring, lack of business understanding, maybe there are patient-related issues, trust, transparency, and non-professional administration of the group, and there is no long-term group policy. The most workable model I've seen is a group of people join together with equal investment, equal stake, and equal work, and equal share of profit. This is the idealistic group practice model which we can see. And these are some of the models which you can explore. A group of doctors using a facility in a corporate hospital. And these are, maybe you can also form a group to set up a mobile unit. Some of the most successful group models in India and abroad, like Modern Eye Hospital in Nellore, Dr. P.L. Rao, Disha in Kolkata, and Dr. Tejas Shah, Jyoti LASIK Center in Bangalore. So yeah, these are my contact information, and maybe I think we can have some time for discussion. And Thank you, Dr. Tejas and AIOS for giving me the opportunity.
Yeah, thank you, Dr. Senthil. That was an awesome presentation. So I will go back to my slides and try to exit. Okay, so the final presentation, which is exiting a group practice. Well, as you all know, it is always a pain everywhere, of course. Whenever you have to terminate, exit, or finish off something, it is always a pain. And there are innumerable possibilities. So what you can do is you can have a broad-based formulae. For that purpose, we have actually found out that all these exit policies can be done in a better manner if you have a private limited company. And you have a lot of different possibilities, like you need to fix up some exit remuneration according to the present performance of the company. That is one very good way of doing it. If the company is doing good, well, the member who is exiting has a better chance of getting something. But if in some case the company is not doing well at the time of a member wanting to exit, well, he is not going to get a good remuneration for all the investment and the contribution he has made to the company. Vis-a-vis, he might even try to postpone his exit. And that is why, for me, the exit remuneration according to the present performance of the company is the best and the most suitable way. Well, and how do you decide that? It depends on the primary investment, the number of years that the person has actually been inside the company, the contribution to the company, the status, which is the profit or loss of the company, and the most important aspect of an exit or a deterrent, you can say, is the clause that he or she cannot practice in a radius of 200 kilometers from the primary center of the company. Well, this actually is very important because there have been many instances where a member has worked for a few years and then he has tried to hijack the entire center. This has happened in many places across the country, and that is why this should be a very firm and ironclad rule that he or she cannot practice in a radius of 200 kilometers, so that there is no question of a hijacking of the practice. There have been instances where a doctor has taken the entire staff with him and has left the center. So all these things have to be kept in mind while we are actually trying to form our exiting formulae. Some important terminology which I would just like to briefly touch upon is conflict of interest. Whenever there is a group, the ideology has to be such that there is no conflict of interest. If I can give you a small example, well, if a doctor gets more money for seeing the patient, he or she is going to try and see that he or she actually diverts the patients to his or her name. And that is why the ideology and the fundamentals have to be in a way that there is no conflict of interest. But well, this also has to be guarded against complacency of interest. If one doctor does not work and still gets the money, well, that also should not happen. So it's a fine line of balance between conflict and complacency. Very nicely said is close your eye and open your eye. But it's the other way around. It's close your eye and also close your eye. Revenue sharing. This is very important, which determines your staying in the group or exiting the group. Because what at our place we do is, well, a doctor cannot take innumerable leaves, right? So we always make all the doctors a daily wager. I am using the terminology daily wager. If you are in the hospital for a certain number of days, you get a fixed income. And over and above that, for operating any patient, you also get a very minuscule amount. Say, for example, you operate a LASIK patient, you get 1,000 rupees as your own money. Besides that money, if you charge 30,000, the entire 29,000 goes to the company. Well, leaving your ego is a very, very big
Hello.
possibility. And
Hello.
it has to be a lot of period. Well,
Yes, sir.
if you join a company, you cannot leave the company before a certain amount of time. And very important is the concept of ombudsman. Well, there are so many heads, so there are going to be some differences. So what do? You should have a person who does not have any conflict of interest or who does not have any ulterior motive with the group. So you have to select a person for as an ombudsman. Say you are practices in Ahmedabad, you select a friend from Nagpur or say Kolkata and make him an ombudsman. He is aware of the day-to-day situation, and whenever there is a conflict or there are two groups, he can be the deciding factor. Something simple is 10 lakhs for 10 years. If there is a 10% profit year on year, well, this person can get about 20 lakhs at the end of 10 years for his. This is a very broad-based formula that I have shared. Well, the other thing is you can initially only say that a very simple interest, a basic interest for all your contribution might be given. If you want to leave after say 7 years, it would be 2%. If you want to leave after 10 years, it could be 3%. Something like this also can be worked out as an exit formula. And of course, you also have to make sure that the exit formula remuneration has to be in installments. It cannot be as a one go, otherwise it will be a big burden on the company. So all these things have to be actually tied up inside the clauses, and it will also always work well. A big example, some examples are a refractive surgery center we had. In fact, I had two centers to begin with, and one of them had to be dissolved because there was a heartburn among the partners because one person was doing more surgeries and other was doing less surgeries. Well, of course, the revenue sharing was, because it was a surgical center, not conducive for a group, and so we had to close down that refractive surgery center. But well, our group practice is still on. Right. With this, I will stop sharing my screen and invite any questions if there are any. I hope we have a lot of participants from the next talk, next instruction course. And they are all eagerly looking at me when am I going to conclude. Well, don't worry, I still have a couple of minutes left. I had somebody asking me a question about how to incorporate aesthetics into the practice. Well, that is a very, very easy job, and it's also quite rewarding. I would encourage that doctor from Cuttack to ask me on my private chat because I don't want to hold up the next instruction course. So with this, I thank all my instructors, Dr. Usha Johri, Dr. Reshma Johri, and Dr. Senthil for participating and being active in this course, and all the best to the next instruction course.
Yeah, Dr. Tejas, I have a question for you.
Oh, Dr. Ratish, the big guy, tell me.
A very simple question.
Yes.
In the partnership, do you look after only importance is the finance, or in the priority wise, finance come in what numbers? Is it the priority or?
Very good point. To begin with, we had an investor in our group, but investor in a group is a big no, because we want only participants who can participate in the form of patients, because there is always going to be a revenue which is going to be given for operating, right? And nobody makes enough money. The investors cannot make enough money. We make more money because we also have a satisfaction. It also satisfies our ego, you can say. And that is why investors, only an investor is not. We have, if you have a retired doctor, an ophthalmologist, try not to include him because he doesn't earn enough from only the profits. You do not earn enough only from the profits of the company. So always have a person who can contribute patients and money both. Thanks, Dr. Ratish. Thank you for the question.
Thank you. Thank you. It was nice talk.
Yes, thank you.